Hello, colleagues. I want to thank you and the Slovenian National Association for the great honor of speaking to you. I'm sorry I can't be there physically to meet you in person. I visited your beautiful country over the summer and I can't wait to go back, and I would hope to meet you all personally in the future. But again, I'm very grateful for this opportunity to speak on behalf of the Patient Office of the European Association of Urology. So the purpose of the European Association of Urology has always been, even in its 50 years in existence, but right from the start, the EAU placed the patient at the center of everything it does. It's in its purpose and mission statement. And indeed, that was visionary, because we have seen that now modern healthcare, and this is a graph of the American healthcare system from a major American public health system, the patient is truly now placed at the center, and treating patients locally in their communities and patient helping themselves is as important as hospital care in modern healthcare practice. And urologists can't be immune from that. So the EAU has created the patient office to integrate patients' experience into the activities of the EAU. Why? Well, what is patient-centered care? Wherever or whenever the patient's experience is measured, it enhances healthcare, and it certainly enhances urological healthcare. And how do we measure the patient's experience? Well, patients basically tell their stories. They voice their experience, which are measured formally in the form of patient-reported outcomes, health-related quality of life measurements, etc. And the purpose of this is that we are asking patients with urological disease how they live with their disease. And that experience is integrated to the various EAU offices, Office of Education, the section offices of incontinence, reconstruction, cancer. But also, which is just as important, is that the EAU show they are listening. And how do we do that? By getting the patients actively involved in the various offices and the EAU's activities. So why is patient-centered care so important? Well, because it works. It's defined as important as one of the pillars of modern healthcare, as important as reducing medication errors for best patient practice. And it's been shown statistically to improve a lot of domains of healthcare. Diagnoses are more accurate, satisfaction is higher, outcomes are improved, adherence to medical advice is higher, and self-management of medical conditions is improved under the governance of the urologist. The urologist is the critical partner with the patient. So, as I say, why have a patient office? Well, it works for all the reasons I've just given. It improves as urologists if we partner with patients and listen to their outcomes and their voice, then all those important parameters of healthcare measurement are improved. There's another point, and I think urology must realize that people are, of course, living longer, but living longer often means living with a chronic disability. The biggest healthcare challenge is that people are living with chronic disease. And neurological conditions are a major cause of chronic disability as people age. And we have a critical role here in helping them live with their disability, because patients are now demanding a bigger role in managing disability. How does urology have such an important role in chronic disability? Well, look at prostate cancer, the most common male cancer. What about cancer survivorship, which is increasing for our 5 main urological cancers? BPH is endemic in men as they age. Urinary incontinence is predicted to be more prevalent than hypertension and more costly to healthcare systems. Sexual dysfunction is a huge issue. Think of not just people with chronic disease, diabetes, and urological diseases. And indeed, of course, incontinence is a big problem with dementia, Parkinson's, neurological disease, etc. And of course, then we have urinary tract infections. So urologists are critically important to help patients live with this such a prevalent issue. Other reasons why it's important, it addresses unmet needs. We can't deal with these particularly as urologists, but the psychosocial problems of having had a cancer diagnosis, living with that. We need to tell our healthcare systems to support patients. There's financial hardship and the impact on family, or what patients tell us are just as important to them. Remember, patients want to know how they're being treated, but they also want to know how they live with their disease. As I say, it's demanded. Patients now, the biggest patient cohort out in the community is millennials, and they are demanding that they manage their own healthcare, but of course, in partnership with the doctor. And if the doctor or urologist doesn't listen to this, there is a tendency to go to uninformed sources in Google, Dr. Google, and this is a risk of misinformation. Patient involvement is going to become regulated. It's part of Obamacare in the United States, and the EAU have commissioned 2 major reports on putting it into public health practice. And any organization that has a formal patient partnership will attract healthcare and industrial resources for support. So how do we put this into practice? And this is how the EAU Patient Office, which is a new office, has done this. Again, the pillars of integrated elements are communication with patients, educating patients, informing patients, and advocating for patients with our policymakers and funders, etc. So the EAU Patient Office, and we're so lucky to have Esther and Andrea, who are the managers of the office and who have really pioneered this endeavor with their own great ideas and business acumen and common sense. The EAU takes this seriously, and we have a patient office board, and this is where the patient office activities, this is basically where the patients who are part of this group integrate into the various offices, the societies, the guidelines. They're involved in guidelines, they're involved in education, and this is the oversight of making sure the patient's voice integrates into the EAU. So apart from the group, the patient office really works because of 2 committees within it, or groups working. There's a patient information working group. These are colleagues who produce evidence-based patient information, informed content based on the EAU guidelines, and also animated videos. And we're fortunate to have members from all over Europe who also act as ambassadors for their own national societies. A key group, of course, are patients. We have patient advocacy group, which are there. It's a committee of mainly patients. We have patients who are patients as well as advocates mainly for cancer and non-cancer urological diseases. They are there to guide us as what is the important issues for patients. They bring focus, they identify the specific needs, and this is important. This is really, they are the real patient voice in the patient office. So the working group, there are members. We're now fortunate that our colleague, Dr. Mia Pool from Slovenia, is going to join us, and we're very excited by that. So what about it? We have the patient portal on the EAU website, and this is where patients can access for information on their disease. The EAU patient information is trustworthy, very important, because it is based on EAU guidelines, and it is high quality, but it is trusted. It's also translated into plain lay language, so the patient can read it. There's a variety of educational materials, videos, medical illustrations, leaflets. It's translated into a number of languages, but English is the prime language, and it covers a wide variety of urological diseases, and it's regularly updated. And here's an example. Our animated videos, which are very high quality, and I would encourage you to access them and look at them, have had 8 million hits on YouTube. And these are very important because they not only inform the patient. But we have our surveys show that urologists, colleagues, use them to help the patient and to educate the patient about their disease and treatment. So the benefits are, it's high quality, ready to use, it's accessible on a website, it's free. It is a multi-language portal, and I admit there are challenges with some translations from English, but that's work in progress. It's absolutely trustworthy. It's based on science, the evidence-based guidelines. It's a tool that urologists and patients use, and of course, nurses, etc. And of course, it goes back to the very fundamental idea that well-informed patients have a better outcome. Finally, our advocacy group, and these are a number of from the International Kidney Cancer Coalition patients. We have Europa UMO, we have the World Bladder Cancer Patient Coalition, etc. We also have the World Federation for Incontinence and Pelvic Problems. These are patients and patient advocates, and they are the real patient voice within the patient office, and they integrate that into the EAU offices. They provide a huge network. They're not isolated. They're working with other chronic diseases, the European Patient Forum, EUPATI, other medical diseases such as chronic diabetes, etc. So they provide a network. So they feed that network into us, and we provide them with a platform and network to you, our urological colleagues. They provide a lot of information, but the highlight is the patient day at the Congress. This is a dedicated patient day where patients present their own research in the patient poster session, and there are roundtables presented by patients about their experience, their outcomes from living with their urological disease. And if I can give you finally a flavor of that, what does the patient voice say at patient day? Well, here's an example. These are by patients. Patient-reported outcomes in prostate cancer following treatment. The outcomes reported by patients differ from those reported by clinicians. Erectile dysfunction after prostate cancer is still not treated satisfactorily by urologists. Patients say after prostate surgery or radiation, they're followed up for 2 or 3 years. Their sexual dysfunction is for life, and they feel it's not addressed adequately. Active surveillance of prostate cancer, there's research showing that it causes considerable psychological stress. You have a cancer, you tell a patient, but we're not going to treat it. And patients with mental illness one needs to be aware of this, that this may cause a lot of mental health issues. There are a number of patients and families who are psychologically affected by disease, by urological disease, particularly cancer. And this challenges to advocate for them to the healthcare providers about financial support. And these are completely unmet by healthcare systems at the moment. Patients are very willing to participate in research, but they need logistical support. For example, someone has to mind their children. They shouldn't have to pay for car parking. And believe it or not, many patients say they help with research and never hear the outcome of the studies. So when seeking information, patients want to know, they're saying, listen to us, listen to what we're saying about our treatment, and listen to how we are surviving or living with their disease. So I'd finish there. This last slide is a patient's expression of how they have lived with urological disease. And I want to thank you again for this great honor of speaking to you.